Hi Mama! Welcome to week 24 of your pregnancy journey. In this video we're going to talk about the baby development, what is happening to baby in week 24, as well as pregnancy symptoms that you may be experiencing and what you could do to help them. So let's start with baby. Our babies are currently around 30 centimeters long, and that is more or less the size of a cantaloupe melon if we were to compare baby to a fruit. So they smell amazing. These babies are little melons who weigh around 600 grams currently, and a lot of development is happening as always. So, from the more exciting things that are happening now, the lungs are maturing and they're developing branches of the respiratory tree. Now, the lungs won't be used until baby is born, but they are maturing and developing and preparing for that first breath of life. Their facial features are now fully formed, which means the eyes, the eyelashes, the eyebrows, the nose, the cheeks, all of the facial features are formed, and that is what your baby will look like when they are born. Lots of movement is taking place. So the baby's moving, stretching, kicking, twisting, cartwheeling away in your uterus. So you will be feeling more and more movement, and you'll be feeling those kicks, and they will feel quite strong at times. So it just shows how strong our tiny little melon babies already are. There's rapid brain development happening, and the most kind of exciting one at the moment is still in regards to the taste buds. So they're still forming, and baby, since a few weeks already, can taste the amniotic fluid and can recognize these tastes. And now the baby can recognize if you, for example, have had porridge every day for breakfast, they will be able to recognize those flavors already. So if you've had a certain thing multiple times, whether it's something more sweet or something more savory, they'll be able to recognize these flavors as well. Very exciting. And if our baby were to be born today, if they came to the world in week 24, there is a chance of survival with intense medical care. The risks remain high, so obviously the longer baby stays in our belly, the better for them. But that's amazing news that already if the baby, for whatever reason, were to come into the world today, there is a chance of survival. So that's it when it comes to our baby melons. Let's talk about Mama. What is going on with us? Since our baby's growing, our belly is growing, you could be experiencing more back pain and more pelvic pain and discomfort. Your posture might be shifting, so you might be kind of moving more forward. So it's really important to try to remember to remain straight, to train the muscles in our backs as well as our upper back and lower back, as well as our full body really, but also our glutes that are mainly supporting this extra weight. There is a hormone called relaxin that is in our body during pregnancy as well as after pregnancy during breastfeeding, and it is called relaxin, and as the name says, it relaxes our ligaments. And this could lead to hip pain and to lower back pain. So if this is happening to you, it is very, very important to strengthen the glutes, strengthen the legs. We are putting more and more weight on our lower body specifically, and therefore it's really important to strengthen these parts of our body. you might be getting leg cramps. So this happens especially during the night, and that is because the circulation changes and there might be extra pressure on your nerves or your blood cells. What can we do to help with leg cramps is to stretch. So stretch the calves, stretch the legs, take magnesium in the evening before going to bed, and stay hydrated. Hydration is super key in pregnancy, so please remember to drink a lot and often. You might be experiencing swelling as well, and there will be more swelling if the weather is hot. But even if it's not hot, you could be experiencing swelling in your hands, in your fingers, and in your feet especially. And what can we do with this? We can elevate our legs. When it comes to the wet leg swelling, we can use compression stockings, and we can also cool our legs down in cold water, and you should also drink a lot. And this should all help with the swelling. You might be experiencing some emotional swings. Again, if you haven't had that now for a while in the second trimester, they might be coming back. And this could be related to the fact that we are coming to the end of the second trimester and we're coming now closer to birth and to meeting baby. So you might be feeling some anxiety because the birth is becoming more and more real and closer. Two more things that you could be experiencing that are worth mentioning: heartburn and indigestion. So make sure not to eat acidic food nor spicy food if you are experiencing that, and to eat smaller meals more often during the day, because our appetite is growing, baby's growing. So just don't eat massive meals all at once, but cut them into smaller meals and have them more often throughout the day. And the other thing is shortness of breath. And this is because the uterus is rising and it's pressing against the diaphragm, which means your lungs are compressing, and it will be harder. It could be harder for you to start breathing in deeply. So just something to note, that is something completely normal. An exciting thing is coming ahead. It is the glucose test. So the glucose test is a test that is carried out between the 24th and 28th week of pregnancy. So you will drink a very sweet drink, and then blood will be drawn and the glucose levels will be tested in your blood, just to understand whether you have gestational diabetes or not. If you do, there will be certain measures you will have to take, and your gynecologist and doctor will tell you about these measures. And if you don't, then life can go on as normal and your pregnancy continues normally. I have made a video about gestational diabetes, what it is, what you have to then do, what to expect in pregnancy, how to adjust your lifestyle. So I will link it in the description box below, so have a look at that as well if you are curious to know. That is all from me for today. Super excited about the 24th week. Let's continue training. I'm going to do a glute training to support those glutes and legs, like we said, to then support our upper body, as well as an arms training. We have to already prepare for our baby coming, so we will be able to lift them and carry them and care for them accordingly. And then we'll also, of course, do mobility as well as full body training and much more. So join me for these trainings. Subscribe to my channel if you haven't done so yet to support me. Tell another mama friend to join us as well. And I hope you are well. All the best. Bye.